Hey, Detoxers. Welcome to a special episode of the Disinfo Detox. We have the whole media literacy wrecking crew here, our resident philosopher, Dickey,
Hey, detoxers.
of course, Sydney Sullivan as well.
Hey guys.
And we have the pleasure of being joined by a guest. Emily Pfender, PhD, is a postdoctoral researcher for the AMETHIST project at the Perelman School of Medicine. Her research focuses on social media and interpersonal messages impact reproductive health behaviors and outcomes, specifically examining underrepresented groups in the United States and Global South. Emily, welcome to the Disinfo Detox.
Hi. Yeah, excited to be here. Thanks.
We're really excited to have you, and thank you for making the time. Your research is so interesting. One of the things that Sydney really gives to this show is making sure we talk about mental health and well-being as we examine folks' relationships with media. So for folks who are just a little unfamiliar with your work, can you talk a little bit about your work in terms of how this issues of health and behavioral change intersect with social media?
Yeah. So, what my research program focuses on is identifying health trends on social media, systematically analyzing them, kind of quantifying what's going on in digital spaces like social media. And then the second thing that I do is I experimentally test those health trends and those health messages on attitudes, beliefs, intentions, and behaviors.
And one of the things I was really drawn to, Emily, is just your kind of like vulnerability or openness when it comes to experiences on social media, especially scholarly communications with experiences on social media. I'm kind of curious from your point of view if you're seeing that scholars are going to have to take to social media a bit more in the future, or if you're imagining that these kind of like more social or popular messages around health are going to continue to go viral and kind of be the main core message.
I think that these messages and these health trends are going to continue to go viral. And that's because influencers, health coaches, and content creators are really good at using effective health communication and even theory based messaging. They're even better at theory based messaging than physicians and scientists. And that's because they have mastered the art of fear based communication using
Mm.
fear and emotional appeals. And fear is what sells and engages people in online environments. And what I see from my research is that providers and scientists are more likely to be using efficacy messages. Talk to your doctor today. We recommend this screening. And that is not what interests and engages the public.
Mm.
Before Dickey jumps in, Emily, can you give us kind of a example, if you have one, of what this sort of fear-mongering influencer content looks like when it comes to issues of mental health and social media?
I don't have any examples of mental health since I don't focus on that area. What I can say from the women's health space is that a common fear mongering message is that if you use birth control, hormonal birth control, you will get cancer.
Mm.
Hmm.
Yeah. Thank you for joining us. I am curious, like, if you could teach every social media user like one kind of thing about the messages that we consume that can influence our behavior, what would that be?
So, what to look for? What are the red flags?
Yeah, especially when it comes to like the fear mongering and the language and just how to recognize, how to resist the manipulative messaging.
Causal language.
Okay, could you say more?
Sure. So if someone is saying that something directly causes something else, so for example, the one on sunscreen causing cancer right now is really hot.
Oh, my partner's a dermatologist. So yeah, I've heard that one before.
Yeah. So when people say that one thing is going to directly cause something else and then follow it up with, and I have a solution and you can purchase it here.
Mm.
Influencers do a really good job of creating causal problems for you that you didn't know you had and then selling you a solution that you didn't know you needed.
Mm.
In terms of women's health, this is a practice, this fear to sell products that predates the internet, correct? And just can you talk a little bit how you got interested in this topic as well?
I got interested in it because I noticed in 2021, when I was a second year PhD student, I noticed that a lot of women were talking about discontinuing hormonal contraception to be more natural and
Mm.
to avoid synthetic hormones and to avoid all of these negative impacts of it essentially destroying the female body. And I, just came across this content on my own just as a regular social media user. And I thought, well, I wonder, if this is actually a systematic trend, or is it just something I'm seeing on my feed? And so I did an analysis and a study of it. And that study is ultimately what took off and created this research program for myself.
Mm. Yeah. Yeah, there's so many things like that that I see too on social media, and there's so much very linked to monetizing something like blank causes blank. I have something for you. Would you say that it's always the case that there is money linked to these kind of suggestions or these products people have as like a cure, or are there other intentions too that are red flags?
I think there are other instances where, especially for women, and talking about the medical field and them being silenced, ignored,
Mm,
experiencing disenfranchising um, medical experiences, I think that they're genuinely sharing those experiences about not feeling heard.
mm,
And one of the things that we know about social media is that people online listen, whereas sometimes physicians don't, or at
mm,
least they make people feel that they haven't been heard. That's very common, especially for women. And so there are unintentional fear mongering and misinformation, spreading as a result of some of these disenfranchised experiences that
mm,
really resonate with people. I did a study on this. This is kind of in the mental health space for premenstrual dysphoric disorder, and we found that videos that talked about disenfranchisement, so feeling silenced, ignored, stereotyped in medical settings with medical professionals, got significantly more saves and comments.
mm.
So it was sparking discussion, and people felt compelled to save this material because it resonated so deeply with them. And so these are the types of things that we see that are not linked to products or sales that are also going viral and
Mhm.
also contributing to misinformation as well.
Yeah.
Yeah, I find that really interesting. The people turning to the social media because they are feeling sort of dismissed. Um, I've been we on the podcast we've been looking at like the AI chatbots and the rise of that and how people are turning to are not social media, but also these AI chatbots going to them for emotional support, almost like a therapist. And so, yeah, I guess I'm just wondering what your thoughts are, if your research at all has touched into the into AI and like what are the risks and opportunities when it comes to turning to AI for that kind of support, or even with misinformation or the manipulation, the fear mongering, the all that's yeah. What's the intersection there? If you found any?
I haven't done any work on AI. That's really my PhD advisor's area that he's exploring right now. So, in a year from now, I'm sure he'll have an extremely deep and theoretical take on that.
Yeah.
He is currently
Mhm.
developing. He's very much into that right now. So, yeah, I think it's a really interesting topic. I have only been in the social media space.
Mm.
Yeah.
Emily, I wonder if you can speak to this. One of the things I think we're still wrestling with in terms of health communication, but you tell me, is the fallout from a lot of the problematic narratives around COVID during the COVID-19 pandemic. And what I mean by that specifically is a lot of valuable, well-researched studies were sort of dismissed for partisan reasons or attacked with forms of disinformation. So do you at least see in your work are, a lot more folks in recent years turning towards social media or AI for health advice in these areas and turning away from traditional medicine sort of as we come out of COVID?
Yeah, I mean, based on what I've seen from the recent literature, up to 80% of people seek health information online.
Oh,
As
wow.
many as 50% seek health information from social media, just from recent studies that I've read. We did a study a couple years ago. We asked college students, why they were seeking health information. This was published in 2023, why they were seeking health information from influencers. And they gave a couple of interesting reasons. They said, well, number one, it's time, it saves time. I don't have to find a doctor, deal with insurance, drive to an appointment for only a 15-minute conversation with someone. And so I can go online and I can find what they say tailored health information. When they say tailored, they're talking about finding someone with a niche area that posts videos about the same thing over and over again, which leads people to believe that they have expertise in it. Because if you post so much content, you must be an expert in it, right? If you have that much to say. And so those were some of the reasons. The niche area, the cost. They talked about how influencers can be experts in their areas if they have lived experience. This is a phenomenon that's been published on more and so in the last 5 years of something we call embodied knowledge, where lived experience with a condition or an illness or some health experience is privileged above expertise and traditional book knowledge, which is quite common on social media, the lived experience. And that's what people value.
Yeah, absolutely. And I'm kind of curious too, do you feel like there are moments or people online who you would trust or you would encourage people to seek advice from, whether that be people with medical degrees that they can like certify and are just happen to be in the online space, or people who are more going through those lived experiences?
I value the experience. Yes, I do think that there are some people that can be trustworthy. I don't think that medical professionals should be giving out medical advice online. I think that's a recipe for disaster. But I do think that there are some trusted sources. I will say that I had a pretty extreme health experience with a hip injury a couple years back. And by 4 doctors, I was told there's nothing wrong with you. We did an MRI. They said there was nothing there. There was nothing wrong with me. It was all in my head. Finally, someone believed me. I got the right test. 8 months later, it was diagnosed, had a massive hip surgery, a year and a half recovery, extreme situation. And the reason why I continue to push and keep seeing more doctors is because I believed that I had found the diagnosis of what was going on based on my symptoms from listening to other people on social media talk about the same experience. And I was right. What I found on social media was ultimately what I was diagnosed with and what the surgery that I needed. And so I do see, there is some value if you're told repeatedly that there's nothing wrong. There is a narrative, on social media to not give up, to keep trying. And, people sharing their experiences gives people that hope and that push to go forward to figure out what's going on with their bodies.
Yeah. What a difficult place to put people in. I mean, I think there are so many cases like yours where people do go through experiences and are told by doctors that nothing is wrong. And then simultaneously, there are people who go through experiences and, have mental health outcomes that they know need to see doctors for. And so that is just such a difficult, like position with the misinformation that continues to like perpetuate online.
Absolutely.
Yeah.
Yeah, that's such an interesting point you made there, though, because I think we hear this a lot that doctors will say go get a second opinion, and by their very nature, it's a practice. So folks are turning to social media, and I'm sure some folks may take the wrong message from that story, but like what you're saying is basically that there's still some important community dialogue that then can be taken to expertise, right? Is that what you're kind of how you would describe your experience?
That's how I would describe my experience. I would also say that in our study on premenstrual dysphoric disorder, a lot of people were sharing treatments that had worked for them that were recommended by doctors. And so it also can be a good way to get information out there to people who may not be able to see medical professionals that might be from disadvantaged backgrounds. And so some of that is actually quite useful. We evaluated the treatment options and most of them were, based in the literature.
Mm.
And then you mentioned, or I could see, sorry, in your bio, and you've talked about it already about maternal and reproductive health and looking at these messages. Is that an area also that you see continue to more and more influencers are going to that area because there's an opportunity to make money there? Is that a growing kind of area of target for influencers looking at maternal and reproductive health messaging online?
Yes. So, what I know from the research is that women's health, OBGYN, and maternal health and pregnancy are the top health topics on social media that are discussed by influencers. Parenting and pregnancy, in particular. We're doing some work around that right now. It's not published yet, but some recent research around preeclampsia, which is a leading cause of maternal mortality. Lots of personal experiences and stories shared online about that as well. We were evaluating messages from, patients and providers. We looked at whether or not misinformation was prevalent in those types of messages. And so, yeah, lots of pregnancy related information and parenting. I don't deal with that as much, but I'm just getting into kind of the maternal health space and social media.
Okay. And just a follow up, and I can let Sydney jump in. I've watched a bunch of those documentaries on the dark side of kid influencers, and I wonder, is there any crossover between this kind of like kid influencer sphere and the parenting reproductive influencers?
I'm not sure. I'm a little less familiar with that space.
I'd be curious when you're doing this research, and maybe you haven't like directly asked people this or directly researched this, but I'm curious if you have a sense for these influencers. Do you feel as if like they're people who come with good intention but bad outcomes, or do you feel as if they are more like wanting to sell, wanting to scam people?
You know, I that's a great question. And I follow a couple of people that are absolutely the antithesis of what I stand for and do
Mm,
and research. This specific woman in particular, and I just can't tell. And part of me thinks that she really believes that she's empowering women.
mm,
She is an advocate for women. She's empowering them. She's helping them understand their menstrual cycles, telling them about the dangers of birth control. She's telling them everything that doctors won't tell them, is kind of
mm.
her motto. And she just gets the highest engagement on stuff that I am just blown away by.
Yeah.
She sells courses on menstrual cycle tracking. She sells courses on PMDD, on PCOS. I mean, all of these different, deep, like complex metabolic conditions that she's selling courses on. And she'll be like, comment this for my course, and 600 people comment for the course. Now, do we know how many are signing up? No. But I I think that she believes she is doing something good, but also making a living at the same time. And this is just, one in many influencers I follow who do this. And I just believe they couldn't be less qualified.
Yeah. 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 I'm always curious. I got fascinated when forgetting the author's name now, but the author of Cultish first came out with like things about cults and like how people essentially like believe that they're doing something like holy or justified and like deeply rooted in what they believe to be right. But that's like objectively wrong. And it is fascinating the way that some people I genuinely think like maybe aren't necessarily in it for the money or in it for a living. That's the outcome. But what's happening as a product of it is so terrible for the individuals who are experiencing it. So it was good to hear like your insight on that too.
Yeah, it's very interesting. And I would also add that as a content creator myself, I have certainly monetized parts of my social media, right?
Sure.
I do believe as a PhD, I'm selling evidence based information and packaging it in a way that's consumable.
Right.
But, I would imagine the same thing is happening to them that's happening to me. And that's that people start to see you as an expert and they DM you and they say, oh my gosh, could you create this and you could sell it? And people would love to have your services. You seem like such a great person to speak on this. It's simple stuff. I mean, just really simple things that people want me to create products for and speak on. And I can imagine that that's happening with tons of people, regardless of their credentials.
Yeah.
It's really, really fascinating, interesting work. Can you tell people where they can go to follow your work and learn more?
Yeah, so I'm on Instagram. It's just my first and last name, Emily Pfender.
Cool. All right. Well, we'll send them that way. And thank you so much for coming on the Disinfo Detox, Emily. It's been a pleasure to host you.
Yeah, thanks so much.
Yo, detoxers, this is the Disinfo Detox. Want to keep media literacy alive and kicking? Chip in at patreon.com/disinfodetox. Broke? We get it. Just like, comment, follow, or share. Even your hate helps the algorithm. Thank you for supporting the Disinfo Detox, where media literacy meets breaking news.